Hello, everybody, and welcome to another episode of Dynamic Living. I'm Tom Clasby, Director of the Kennedy Center, home of the Quincy Council on Aging. I'm delighted that you've tuned in. We have a very interesting show for you today and an important program. My guest is Sheila Wilson, who is the president of Stop Healthcare Violence. And I think many of you are going to be surprised at what you hear today, but it'll be great information and a way for you to get involved in her project. So Sheila, how are you?
I'm great. Thank you for asking me to come on.
Well, go ahead.
This is one of the ways that I wanted to heighten the awareness of what's going on with the violence in healthcare.
Yeah, absolutely. Very, very important topic for us to discuss today. But before we get into that, why don't you tell us a little bit about yourself? Give us your story in a nutshell.
Well, might be a big nutshell.
Yeah, that's all right. That's fine.
Older.
We get a little bit of time.
I actually was born in Quincy. Moved to Squantum, lived there as a teenager. There was kids and dogs all over the place. One road, still is one road. It used to flood, so we'd have to take the boat over sometimes out of the road.
Sure.
And we thought, actually, the Kennedy Center was a school, right?
That's
we
right.
thought for sure it would sink.
Yeah.
And it's still up there. I'm very surprised. Went to North Quincy, then got married, and then after my children were probably going into their maybe 10, 11 years old, I had always wanted to become a nurse. And so I started out in a nursing home as a medical assistant. Then I went to County Hospital as a medical assistant because they paid $1 more. It's not that I didn't like the elderly, but
Yeah.
So from there I went to La Brea Junior College, and then I went to UMass Boston. And then I went to the School of Public Health for a master's degree in public health in BU School of Public Health.
Yeah.
And as I watched all of us, I worked in all places at Connie, loved the Connie. That was a fabulous place to go. I went to the ER, and I've been there for 17 years.
Wow.
I had been there for 17 years. I'm now in occupational health. But the violence was getting worse.
Uh-huh.
And there's not one person or one group of people that assault us. It's a whole variety. And we need to be more aware of what can happen up there.
Yeah.
But I've been very lucky.
Yeah.
You know, I love nursing. It's not a job, it's more of a calling.
Right.
I'm very passionate about my coworkers getting hurt. Some are out in disability. And that's just not right.
See, now as this conversation happens, you and I have a lot in common because I'm a Squantum kid, and I'm a North Quincy High School graduate.
Wow.
As was my mother. And my mother used to tell me all the time, marry a nurse. She used to say, they'll make good, they can always get work, they make good money, and they'll take care of you. I did not take her advice, but I do have a lovely wife. So, but anybody that's been in the hospital or had a loved one in the hospital really knows the value of nurses. Doctors are wonderful and we need them certainly, but the care that you receive on an hourly basis is because of our nurses, and they do fantastic work. This whole issue of violence, when you and I had a chat at the Kennedy Center a few weeks back, it never occurred to me that it even happened, or I suppose, if you did hear about something that occurred, you'd think that, well, that's an isolated incident. So, but you're here to really shed a little light on all that.
Right.
It's not isolated.
It's not an isolated incident. I've worked in a lot of different hospitals, so there's not one hospital that has more violence than the other. And just to maybe refresh your memory, one of the hospitals I worked at, I was not there that day, but a prisoner come in for an appointment in the emergency room, which you don't think prisoners get appointments, but he comes with 2 guards, and that's what usually happens. And this hospital had security guards that could watch what is going on in the emergency room. So he had his appointment, the doctor saw him, and he said to the guard, that he needed to use the restroom, and he needed one hand free. So the guard apparently probably knew him from where he was, held prisoner, and undid one hand. So he goes in there, and then when he comes out, he starts wrestling with the gun. And apparently, now as I said, I wasn't there, he shot the other guard, but the guard over where the patients are shot him.
Wow.
Both hospitalized, but the concern was that he was no further than 5 feet from the nurse's station.
Right.
Luckily, he didn't hit any of the nurses.
Yeah.
And you think to yourself, wow, what could have happened at that time? And whatever possessed that. Now, this isn't fact, but I had heard the reason why he needed that hand undone was because he planned on passing a key.
Yeah.
Now, look at, how did he get a key?
Yeah.
It's just like all of these kind of things that you don't think about.
Right.
What happens. And so it ended up, as I said, the prisoner and the guard, I believe both are alive now and doing their own thing, but that's something that happened.
Yeah.
Another incident was this nurse, Elise Wilson. No, she's not a relative of mine, but she's doing her triage duty, which is the triage nurse usually sits out and accepts all of the patients coming in for treatment, and then she decides whether or not they need to be brought down immediately to the ER or not. She was ready for retirement, probably a year, 2 years, and she noted a young boy, I believe, that he was just there. He's just a young man. And the next thing she noticed, he was right there in front of her, stabbing her.
Wow.
11 times.
Holy smokes.
Now, where was security? And I'm not saying anything about the hospital or anything, so please don't misunderstand. How can somebody stab you 11 times and not have anybody around to help you?
Yeah.
So she probably is, like any other hospital, sitting there with registration. Security might walk by once in a while out in triage. And then to get her group, unless you could call. And when this gentleman was questioned, why did you do that? He was upset about his care that he was given 2 weeks before that.
Wow.
So did somebody miss the fact that he was prancing around? Did he not prance around? But this is, we're so quick to blame some people. Oh, it has to be a drunk, or it has to be somebody that's high. That's not always the issue. It's somebody that is, you just don't even know that they're. 1 minute they're smiling at you, next minute they're pounding the living daylights out of you. One of my nurse friends was grabbed with her stethoscope and was choked with it.
Wow.
Just our little name tags used to have, they'd be solid. Now it's a lanyard that you can pull.
Right.
So nobody can, choke us that way.
Yeah.
But this goes on. Now, one of my other coworkers, she had come in from triage, and the way that the rooms were set up, she just looked, making sure everybody was okay. And she, it's not funny at all, but when she looked, she saw the security guard on the floor getting pounded by a patient. So she thought maybe she should yell for help, get more security. So and get a stretcher. Well, they got the stretcher. The whole staff. Now that's why, if your staff is involved in all of this type of, chaos, then the patients are neglected.
Right. Sure.
And they don't know, except I can tell you a story about one other one that she wasn't neglected. But she, so they got the stretcher, they got the guy onto the stretcher, and they were able to put him in leather restraints. He needed to calm down and relax.
Yeah.
But one leg was out, and he still had his boots on. And he got this nurse several times, every time she went to get that leg, and she was getting help, that he would kick her in the same spot.
Wow.
Well, she ended up on workman's comp, and now she's on disability. Now she's a grandmother. She takes care of her grandson. She has a family. She takes care of it, and her income is gone. There is nothing for her, and she will never work again. She can't perform CPR, so nobody wants her in acute care, because you have to at least know how to, if somebody goes into cardiac failure starts to die, you want to get them back if you can. But this is the type of incidents. She was on, I can't remember, but Channel 5, that program that goes on.
It's a Chronicle?
Not quite Chronicle, but the one that goes out and really highlights everything. They're a good show, but the name has slipped my mind.
Yeah.
But now, the other nurse, just tough. The PTSD is, you just never know, we're threatened all the time. And they'll tell you, I'm going to come back and I'm going to kill you.
Yeah.
And I know where you live. Now, that kind of just jars you a little bit, and you say, oh, he's not going to do that.
Right.
But you end up looking over your shoulder.
Yeah. Yeah, not that, nursing, you're dealing with such important things, administrating medication and everything else, and you really need all of your wits about you.
Right.
The last thing in the world you need is worrying about looking over your shoulder and being concerned that you might be in danger.
Well, every day you walk into the emergency, when I was working in the emergency rooms, no matter who you are, you may say a prayer, you may just think of your higher power, you might think of something, and you hope, and you check. And then one time we had no security at all in the emergency room, so as a group of nurses, we were doing workplace violence committee meetings, because it really had become an issue, a tough issue, not just, oh yeah, we got one person hurt a month.
Right.
It's like maybe 4 a day.
Wow.
Maybe, a scratch, and purposely scratched, but you don't know what's underneath those fingernails.
Sure.
One of our nurses, he was fixing a nasal cannula for somebody to get oxygen, and as he was putting it on, the person bit him.
Wow.
And he was on antibiotics for 4 days. He couldn't work. He had a finger out like that. It's just, these are just the little incidents.
Right. Yeah. So, when was your organization formed, or how? Give me a little kind of a picture as to how you got together and decided to form an organization. Is it something that was discussed for a long time?
Well, most of the nurses in the emergency room, we were close, but not always friends. I mean, you go there to work.
Right.
And so when we had the workplace violence committee meetings at the hospital, we said, something else has to be done. We need, trained security guards that know what they're doing. We need this, we need that. And so 3 of us got together and we formed StopHealthCareViolence.org back in 2008. And from there we thought, our goal would be to make the other, not make, but suggest that the other nurses and the medical assistants and x-ray techs and all that become change agents. Talk about it when somebody assaults you. And it's taken a long time.
Right.
We would have, I don't know if you've ever had an x-ray. You go into the x-ray department. Good. But the technician is by themselves.
Yeah.
So I had a call from a woman that was doing a mammogram. She was a tech. She was assaulted by the person that was having a mammogram.
Wow.
And it was like, but the point I'm trying to make is, where is their security?
Yeah.
Now, the easiest thing in the world is put a panic alarm in their pocket that probably will cost a few bucks.
Right.
But you know what? Somebody would come to them.
Yeah.
X-ray, though, locks their door.
Yeah.
So if they can't get away from the assailant, they'd have to walk around to the back door.
Yeah.
So at least they could get in.
Yeah.
But that woman in doing the mammogram, she had to leave to tell her supervisor. So from there, as I showed you, I wrote a book.
Yes.
That's
yeah.
more recent than 2008.
I'm going to hold that up.
Oh, thank you. And I have written lots and lots of articles, and they're on the nursing magazines. And I've gone out and I've given lectures, just talks. This is
Right.
what we need to do.
Yeah.
Now our goal is to make everybody safe. And how do you do that?
Yeah.
And that's where you need everybody to work together.
You've made a career in hospitals, so we're not here bashing hospitals in
No.
any way. You know, we just want to come to a solution to a difficult problem. But I would think there would be a certain amount of pushback from, you know, administrators that might say, hey, look, we don't want, you know, to focus on the negative.
Right.
But really, you know, we have to. And what's going to be required is new legislation, you know.
And that's what Stop Healthcare, we try to lobby, and we have 2 bills out. And they're the Senate Bill 838 that was sponsored by, or is sponsored by, Michael Brady, and a House bill with Representative Paul Tucker. And that House number is 1578. And Representative Paul Tucker was a police officer
You mentioned
and
that,
a police chief.
yeah.
And so, as I mentioned earlier, when the nurses actually call to report an incident with one of their patients, they'll call the police. But the police can't arrest when they come in, no matter how many people say that I saw this person do it. The police they can't do anything. So it almost feels as a nurse, well, why do I even bother? I write an incident report because the patient, you know, slapped me around and I have a black eye, or my back and neck is out of joint and I'll be out for 4 months. And there's no response from that. So
Just to expand on that, so is that because of like HIPAA laws, or what would be the difference between somebody going in and assaulting a clerk in a store? You know, you would assume if you called the police or reported it to the police that they would be able to follow up on it.
well, I wish I could answer that.
You're not sure, okay.
I'm not.
Yeah.
And I'm sure Representative Tucker
Yeah.
told us, but my head
Right.
was still
No,
somewhere
yeah,
else, and
no
I'm
doubt,
thinking,
yeah.
I wanted to have him do a PSA, and he agreed to it. I just need to find nurses out in Salem, and I'm not familiar with Salem, you know.
Yeah.
But it's just so disheartening, you know. The administration doesn't respond to you, and then you call the police for some help, and they can't do anything, and then you go to court. Now we've been to court, and one of the girls was, she was spit in the face, and she was, I think, hit at the same time. But anyway, she brought the young man to court, and I was with her. And he comes out of like the holding whatever in the courthouse, and he looks at everybody. He turns and he smiles at her and gives her a wink. Well, you say to yourself, no, it took a lot to get her to stay down in her seat.
Oh, no doubt, I'm sure.
We don't want to be, you know,
Yeah.
kind of a pest at the courthouse. But
Yeah.
and then they just let him go. You know, another person went to court. I was with her. She was punched in the face. She knew the patient. But he got angry because she didn't quickly give him the telephone. Now, he had chest pain and he had high blood pressure. That's what the EMS said. Yeah, emergency medical, you know, the ambulance.
Yeah.
So she had to do this. She had to make sure his heart was okay. She had to check on the blood pressure. And he just whammed her in the face. Well, she was black and blue from here all the way down. And she got pushed up against all of he ended up in the trauma room, only because we were so busy that night and he used the room. She landed up against all of the the structures, all the shelves and everything else, and really twisted her back and her neck and her lower back.
Right.
So she was out of work for like 4 months. She comes back to the ER and she couldn't do it because of PTSD.
Sure.
Then she goes to where her floor was before she came down to the ER, and she could hear this person breathe while she was walking. And so this fella had a trach, so it was a different type of a breathing.
Yeah.
And she just wants to forget the whole thing. But she did go to court, and the judge kind of said, I know you and your family would like him in jail, but, you know, he really didn't go in there with your name in his mind. So, you know, maybe if you go into a store and you shoot the clerk and you don't know the name, maybe that's an excuse.
Yeah.
But so he gave him some probation with alcohol and psychiatric treatment, and he was to write a letter to her and everything. That wasn't done.
No. Yeah.
So it's like the nurses get disheartened.
Sure.
It's almost like, why bother?
Right.
But if we don't fight for it,
You
then,
have to. Yeah.
you know, like you, the public isn't aware that
Right.
this goes on.
Yeah.
And the one last story that I'd like to say is, are you okay?
Yeah. We're fine. Yeah.
This one particular girl, she was jumped from behind. Now, she came from a large Irish family. They were always fighting, but she said nobody ever got you from behind. It was always face to face.
Yeah.
So, okay, that's great. But it took 7 people to get this woman off her back. Now, her biggest issue was she was in almost taking care of this 80-pound-year-old female. And she said, when she jumped me, I thought I was going to land on her. And she's a tall girl, a few pounds on her. She would have really hurt her.
Wow.
Because the one that jumped her was just about the same size. So, you know, you're probably putting at least 350 on the woman.
Sure.
And she said that scared the heck out of me.
No doubt.
And she really, and so of course she was out of work for months. She couldn't stay there any longer. So she left. And she ended up with some issues after that too. And it's just not an easy thing.
Right. Just a couple of questions as we've gone through this, and you mentioned the ER. Is it more prevalent in that kind of a situation, generally, where it's ER or you mentioned, you know, X-rays? In other words, not a person that's necessarily committed in their bed. Although I'm sure there are situations where that happens, but is it generally more you know, prevalent in the ER? Or?
Well, the ER is where the people come in. So you see a lot of different people, and yes, a lot of things can happen.
Yeah.
However, when a patient is sick, really truly sick, that needs to be in the hospital, they go to the floor. And so nobody really stays with them. I mean, you could have a sitter there, but they're a sitter that isn't, well, they're trained, but they're not like Karate Kid that could
Right.
take them down.
Yeah.
You know, they also,
Yeah.
there was an incident where somebody walked right past their sitter and ended up hurting a nurse, almost killed her.
Right.
And so this is what happens.
Yeah.
Now, the bill that we talked about with Senator Brady and Representative Tucker covers the emergency technicians and all of them. When they come into the emergency room, they're the best people in the world. But they get assaulted so much. And we've taken care of them when I worked in the ER. They get pepper sprayed. They get thrown down a flight of stairs. Somebody will call, and somebody else will say, I don't want you here. Wham, down you go. They're beaten. They're scratched. These folks, if they decide that they don't want to do the streets anymore, where do you think we'd be?
Yeah.
It's not easy.
Yeah.
And it's not easy for them, but when they bring a patient in, they're right there with us. And if anybody, like the incident I told you about, the patient that hit the nurse in the face,
Right.
they're the ones, because we at the time only had one security guard in the ER, and he was probably with somebody else. And so when she said, I just got hit, that fellow was off the stretcher, beating his face and his chest, like King Kong. And
Sure.
so EMS was there. So if they got hurt, they have no protection. They don't have the law. 34 other states have a felony law.
Yeah. Wow.
And Massachusetts is just...
And it's funny because Massachusetts in many ways is a leader in, they've started a lot of, like, even, our elder services on the state level is in many ways ahead of other states. So it's kind of surprising that we're, behind on this issue.
Well, it is. You know what's the biggest, and it just doesn't make me laugh, but I like animals. I think they're great.
Yep.
But when a puppy bill gets passed in 9 months,
Yeah.
and your nurses, not to say anything about
No,
puppies,
yeah, I
but
get it.
this is now going on to 10 years. And why?
Yeah.
And that's what I don't understand. If these people sponsor the bill, why isn't the wording so that everybody wants to protect us?
Right.
And why are the jails so full? I mean, they still have people that... And, being a nurse, I just can't get into all of that because it's so easy to fix, to
Right.
keep us safe.
Yep.
We don't need tons and tons of money.
Mm-hmm.
We need people, we need security guards in there. Then one of the states is thinking about having security guards with dogs. Now, I don't know how, hygiene would be having the
Right.
dog right there, but
Right.
they've had another hospital I worked in, the dogs came with the patients because they were there
Oh, yeah, I know what you mean.
to help the
Yep.
patient.
Emotional support or...
Yes,
or
and
yeah,
the
yeah.
nurses had to take the dogs
Right,
out
right.
to relieve themselves, and
Yeah.
so it would be good if we had a big vicious dog in there, and that would maybe calm
Yeah.
people down. I don't know.
What can the average person, we have people that are in our audience right now, what is it that they might be able to do to help?
Well, I did speak to Senator Keenan,
Mm-hmm.
and he said one of the most important things is for people, the public and nurses and EMTs, to go and call their representatives, call their senators, let them know face to face who you are, and write letters. That would be good to support these bills. As I said, Senate Bill 838 and House Bill 1578.
Great.
And just support us and get this felony bill passed.
Yeah.
That would be and know that, be aware when you're in the hospital.
Yeah.
Don't just trust anybody.
Right. No, I think it's important that awareness is key, and people can get involved, so they can write their senator, Senator here, Senator Keenan, and Representative Ayers, Chan, Mariano. People will be watching in other areas. Write their representatives, their senators, and ask them to get behind this. It's important for sure.
Representative Ayers is fabulous.
Yep.
He wrote a bill for me one time.
Great.
So this has been going right down.
Yeah.
I mean, it's years.
Yeah.
It really is.
Yeah. Yeah, again, as I started off, I think it's sometimes this seems to be something that has just kind of slipped through the cracks, and we want to make sure that it doesn't do that any longer, and support the bill, and it's probably got to be a stepping stone to hopefully stronger legislation that we can rid our healthcare facilities of this kind of senseless
That
violence.
would be good.
Yeah,
That
absolutely.
would be good.
Well, thank you so much. You've been terrific. We're going to have some of your materials available at the Kennedy Center. We have brochures and stuff, so I know you're in every now and then, and maybe I'll talk to you a little bit about getting some of your books, so if people want it, we can give them to them. But it's certainly been a pleasure to have you here. It was a sobering topic, but but we're glad you're here, and we hope we can help.
Thank you. This will bring out a lot of awareness, and to let people know that we are getting hurt, getting
Absolutely.
assaulted, and I have to thank you for that.
Well,
That's more important than a lot of things. That if we could save another nurse, that would be really good.
absolutely. We need those nurses to give us good care when we get sick.
That's right. We're losing them because they're afraid.
Yeah, and no one should be afraid in their workplace.
No.
Absolutely not.
Thank
All
you.
right. Well, I'm Tom Clasby. Thank you for watching, and we'll see you next time on Dynamic Living.